So the latest horrifically misinformed thing that I've seen today is not just today in general is this idea that COVID-19 numbers are greatly exaggerated, that states and health authorities and hospitals are attributing deaths from other causes to COVID. Um, that's pretty insulting to people who are working on the front lines and are dealing with all these deaths. It's also pretty easily refutable. You can look at the death certificates, the death statistics by state and by nation, and they go back decades, and you can look at them and see how many people typically die in your average April or March, and then you can look at the statistics from the last couple of months and see that like twice as many people have died. That's unusual, right? Like if you normally have 10 people die in a month and now you have 20 or 30 people dying, um, I don't know what to tell you. That's not a normal thing that happens. So if you have normally 6,000 deaths in the city of New York, or in the state of New York, I should say, for April, and now you have 12,000 deaths, maybe there's something out there like a novel coronavirus that is killing people, or I don't know. I genuinely am not sure what they think is going on out there. Um, there's literally a mass grave in New York. I don't know if they think the bodies that are going in there are just filled with potatoes, or if that's actual human beings and fellow citizens who have passed away at a rate far in excess of what we normally expect to see in a busy city. You can look around at all the reports in other parts of the country where people are, where mortuaries are running out of room to put to put bodies. You can look at the reports. I think one here in LA where they had to call the police in to help deal with the number of bodies in a retirement home because people had died so quickly and so rapidly that they just didn't have a way to safely dispose of them. So yeah, if you've got that uncle or aunt or whatever who's like the COVID numbers are inflated, they're not. If anything, they're underreported. We're looking at we're only really seeing the patients who are dying in the hospital, and there are a lot of people who are going home and dying in their home because they got sick, and we're not going to find them for a little while because we're all locked down, and you should probably check on your relatives at this point. But yeah, so it's not like there's probably going to be a lot more people who turn out to be killed. The other element of this is that a death is only reported as a COVID death if there's a positive COVID test associated with it, or there's a link between the person who died, their particular illness, and someone who has a positive COVID test, or someone who was a known exposure. It's not like someone gets a broken ankle and falls down the stairs and breaks their neck and they get counted as a COVID death. No, they're going to get counted as a COVID death because they died of pneumonia with a high fever, and they were in a retirement home with 15 other people who died of pneumonia with a high fever, and 15 of the staff tested positive for COVID. So that's it. That's all just BS, to be completely honest. It's just I know why people are doing this. I know why they're trying to downplay it. They're doing it because if you sat down and actually accepted that 50,000 Americans have died just in the last 4 months, and really just in the last 2 months, you'd have to make some different choices with your life. You'd have to reconsider maybe going to that open up the country protest that you're planning on going to. You couldn't look at a death toll like that and go, oh, it's not that big of a deal. No, you'd have to definitely change some things about how you see the world. And nobody wants to do that. It's a normal human nature. I get it. But it's also poisonous and crappy, and really crappy to people who are working in the field trying to save people's lives and trying to stop this disease from getting worse. I wish I had a way to convince them. I've yelled at them. I've been nice to them. I've provided them with evidence, and there's just not a way to get around it, because inevitably this is not a rational discussion. This is a political discussion. This is not a policy decision. This is not a, hey, why don't we do this or do that? This is a owning libs sort of thing, where they just want to be right, they need to be right, because if they were wrong, then again they would have to rethink how they what kind of choices they make in terms of policies and people to represent those policies. So this went a lot longer than I was hoping, but I think it's still good stuff. Smash the like and share button, and let your neighbors know about this angry PA sitting in his home office with his dogs complaining about things he sees on the internet. Yeah, maybe not, but if you want to, I would really appreciate it. I do spend time making these videos, and I do enjoy making them, so let me know.